Welcome back, guys. Welcome to Talking Health with Anikia. I am a registered nurse and I recently became a family nurse practitioner. In this video today, we are going to be discussing prediabetes. Prediabetes is a condition in which your blood sugars are higher than normal, but they are not high enough for you to be considered a type 2 diabetic. Prediabetes is a warning sign that you may be at risk for diabetes in the future. What I'm going to be imploring you to do is to act now to prevent diabetes tomorrow. Tackle prediabetes today. Let us look at some symptoms of prediabetes. The first pre-symptom that I'm going to be looking at is darkened skin on certain areas of the body. For example, under the armpit, in the groin, and the neck. Most times, the back of the neck. Some persons think that this darkened discoloration is actually normal, but it is a pre-symptom of diabetes. Let us look at this pre-diabetic sign, which is a higher than normal blood sugar level. And according to the American Diabetic Association, this blood sugar level ranges between 100 to 125 milligram per deciliter. So if you are overweight or have a family history of diabetes, let us consider regular blood sugar testing. Another pre-diabetic symptom is unexpected weight gain. Higher blood sugar levels are directly linked to increased body fat. So if you realize that you're gaining weight or you notice increased weight gain and you consider yourself not overeating, you can consider prediabetes as a cause. So at this point, you would want to follow up with your healthcare provider for regular blood sugar testing, especially if you are at high risk for diabetes. Another way how pre-diabetes presents itself is in the form of exhaustion or fatigue. You always feel tired, especially after eating. A high blood sugar level causes you to feel tired and weak. Another warning sign of pre-diabetes is blurred vision. The patient normally complains of blurry vision and problems seeing at night. What a high blood sugar does, it affects the shape of the lens, resulting in you having blurred vision. So if you notice that you're having vision changes, consult with your healthcare provider, explain all the vision issues that you're having so that proper treatment can be implemented, especially if you are at high risk for diabetes. Another pre-diabetic sign is tingling sensation and numbness in the toes and fingers. High blood sugar levels damages nerves, leading to a condition known as diabetic neuropathy. In this condition, the patient also experiences a sensation of burning in the hands and feet. The next pre-diabetic symptom is increased hunger and cravings. When the blood sugar is high, the body is not able to utilize glucose for energy, and this leads to you feeling hungry. You feel as if you always want to snack and that you are not able to go a long time without eating something or feeling hungry. Slow wound healing is another pre-diabetic sign. Even though this is most commonly seen in diabetic patients, you have some persons who have pre-diabetes who also experience slow wound healing as well. The next pre-diabetic symptom is frequent urination. When the blood sugar is high, the kidneys try to expel excess glucose or excess sugar from the body in the urine, and that accounts for the frequent urination. There are many conditions that causes you to urinate frequently, but this should be a cause for concern for you, and especially if you are at high risk for diabetes, you would want to check your healthcare provider to monitor your blood sugar levels. Excessive thirst is the final symptom we're going to look at as a pre-symptom of diabetes. Exercise and eating salty foods normally makes you thirsty. But if you have this constant unbearable thirst that is unexplainable, you'd want to check your healthcare provider to monitor your blood sugar to see if you have prediabetes or diabetes. It is important to note that not many people with prediabetes experience symptoms, and this is why you want to follow up with your healthcare provider to have a regular screening of your blood sugar done, especially if you are at high risk. Persons who are at high risk for diabetes or prediabetes are persons who are overweight, who are physically inactive, and those who have a strong family history of diabetes. In prediabetes, your insulin level is constantly high. And the reason for this is because of frequent snacking and a constant intake of carbohydrates. If you found this video to be informative, like and share with your friends and the ones you care about. If you have not subscribed as yet, click that subscribe button and that notification bell so you will be the first to know when a new video is uploaded. Thanks for watching. I appreciate you, and I hope that you are more knowledgeable on prediabetes.